Good afternoon. Thank you for joining us for the Generations Magazine's webinar for October 20th. Um, Thank you again for logging on. This is all being recorded, so if you have any family and friends, feel free to go to our website at generations808.com to watch any past webinars as well as today's. We actually had MDX as our speaker 2 months ago as well, so they did a great webinar as well. So please feel free to go on our website and watch that. That was with Dr.
Ryan.
Yes, Dr. Ryan, sorry, brain fart. But yes, so thank you for joining us today. Outside of just some housekeeping, everybody is on mute and no video that are participating with us as attendees, but you are able to chat with us. So any questions that you may have throughout the presentation, please feel free to chat with us, ask a question, and they will get to those answers during the webinar. In addition to our Brown Bags webinar, we also have radio podcasts, Sundays from 8 to 9 on radio KORL, Hawaii's Classic Rock FM at 101.1 and Spectrum Channel 883 and streamed at hawaiistream.fm. So I wanted to thank MDX and Adrienne. They are our speakers this month, and Adrienne, you can introduce your guest speaker. But we did want to thank MDX for their support and their partnership with Generations, and again for their first webinar 2 months ago, and then this webinar this month. Adrienne, I can send it on to you, and you can introduce your guest speaker.
Great, thanks so much, Cynthia. A pleasure to be here. We love working with the Generations, and they're really a good partner with us. So we're happy to come back and do another webinar. So MDX, how people ask who MDX Hawaii is a lot of times. So MDX Hawaii is a provider network that has over 630 primary care physicians and over 2,200 specialists in our network. And we also contract with all of the hospitals in state of Hawaii other than Kaiser and AAA. So if any of you wanted to go to a hospital and you end up picking our network, then you will end up being able to go, whether it's Straub or Queens or Castle on Windward side, or even on Maui or Kauai. So we've been around almost 36 years. So we started as a part of Queens Health System, and Queens Health System decided that they didn't want to be in the healthcare or health plan business. They spun us out, and we have been on our own since then. We are headquartered in Honolulu. Right now we have an office in Waterfront Plaza, but we're moving to downtown next year sometime. And because of the pandemic, a lot of us are working from home, and we are able to actually reduce the size of the office, and so we just needed a smaller space, and so we're going to be moving to downtown. So our core business is working with Humana Medicare Advantage plans, as well as United Healthcare Medicare Advantage plans. So together we have almost 40,000 Medicare Advantage members, and that's bigger than Kaiser, that's bigger than HMSA. And so we are one of the largest Medicare Advantage organization in the state of Hawaii. So today we have Anastasia, who's the sales manager for Humana. She's going to talk about what you need to do. So a lot of so people become eligible to get Medicare when, most of us get Medicare when we turn 65. So, and then there's some exceptions, but I think 90% of us get Medicare when we turn 65, but a lot of us work past 65, and there's some things that you have to think about if you decided to work past 65 and decided not to take Medicare because you're working for an employer and you're also getting health plans. So sometimes you don't need to get double coverage and pay for Medicare as well as your health plan insurance from employer. But when you finally decide to retire, there are certain things that you have to do to make sure that you're not going to be penalized for enrolling into Medicare when you are first eligible for Medicare. So Medicare would like you to make sure that would like you to enroll into Medicare when you turn 65 or when you first become eligible, but you could work past 65, and a lot of us do. But you also need to, there are some things that you have to think about, worry about when you finally decided to retire. So Anastasia is going to talk about how Medicare works and some of the penalties that are associated with the Medicare, and then when to enroll. And then now, of course, Medicare annual enrollment is here, and it ends on December 7th. So she's going to talk a little bit about that as well. And if you have any questions, feel free to put it in chat. I'll monitor that. If it's just quick question that I could answer it. But if it takes a little bit of time to answer, then we'll wait until at the end of the presentation to answer questions. So thank you so much for having us, and thank you for attending. And Anastasia, it's all yours.
All right. Thank you so much, Adrienne, for this introduction. And thank you, Cynthia, for having us both here. MZX and Humana, speaking to you about what it means to be Medicare eligible, things you need to know, remember. And I'm hoping that you learned something new today. And if you do, please share with your family, friends. Why not, right? It's a complicated subject. I'm a Humana employee, so my name is Anastasia Hale. I am Russian, so you'll hear my accent popping in, especially if I get too excited. As a Humana employee, I have been in this Medicare field for combined 6 years, and I'm happy to have your audience today. So let's talk about the agenda. And actually, before we get there, Humana uses this tagline, human care, because we do believe that not two people are alike. If what your neighbor finds a plan that is perfect for him or her, it might not be the best what will work in your situation. So we have to know what you're eligible for. We have to know when to make changes and how to operate through this very complicated Medicare world. So our agenda for today are, so we'll talk about Medicare eligibility, what Medicare is, your Medicare options. We'll cover important dates that I would like you to take a note of, and how to choose a plan that is right for you. Now let's start with, are you eligible for Medicare? Generally speaking, Medicare is available for people age 65 or older, younger people with disabilities, and people with end-stage renal disease. It's a permanent kidney failure that requires dialysis or transplant. So if you are eligible for premium-free Part A, if you are 65 or older, and you or your spouse worked and paid Medicare taxes for at least 10 years or 40 calendar quarters, you can get Part A at age 65 without having to pay premiums. If you're already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically get Part A and B starting on your first day of the month you turn 65. If you're under 65 and have a disability, you'll automatically get Part A and Part B after you get disability benefit from Social Security for 24 months. If you're automatically enrolled, you will get your red, white, and blue Medicare card in the mail 3 months before you turn 65. If you are close to 65, but not getting Social Security or Railroad Retirement benefits, you will need to enroll in Medicare. So you can go online to apply for Part A and B. You can also call Social Security 3 months prior to turning 65. Now, next is, what is Medicare? There are so many different terminology around Medicare, and I call it the Medicare alphabet. So Medicare is a national health insurance program in the United States that began in 1965 under the Social Security Administration and now administered by Centers for Medicare and Medicaid Services, or CMS for short. So there are Part A and Part B. There's Part C, also known as Medicare Advantage Plan, and there's Part Z, prescription drug coverage. And we'll talk about each of these letters of the Medicare alphabet in just a brief moment. There are also special needs plans for people who live in certain institutions, like a nursing home, or who live in a community but require nursing care at home, or people who are eligible for both Medicare and Medicaid, and also people who have specific chronic or disabling conditions. A side note here, Humana does not offer any special needs plans here in Hawaii. If you have a question about this special needs plan, whether or not you're qualified, I advise you to contact our local SHIP office. It's a state health insurance assistance program to learn more. SHIP is a group of volunteers who provide guidance and support in navigating through this complex Medicare questions. And in fact, every year SHIP learns about what's coming up new. So it's a wonderful group of people. I've met with them, and they truly have your back, and they're very neutral and non-biased side of what's out there and how to make determination on the next steps that are appropriate for you. Now, there's also, there are plans that are called supplement insurance plans. We refer to them as well as Medigap policies. This Medigap or Medicare supplement insurance plans are sold by private companies. And they can help pay some of the remaining healthcare costs for covered services and supplies like co-payments, co-insurance, and deductibles. Those plans are standardized and vary in cost from one insurance company to another. These plans used to be popular back in the day, but not so much nowadays, and not that popular here in Hawaii. So they go from letter A to letter D. There's F and G, and then there's K to N. If you'd like to learn more about it, I advise you to look into Medicare New Book. It's really well explained how those plans work. I have to make a note here, those plans are really pricey, and some insurance companies will have you to pay more as you get older. And really, the extra benefits there are limited, so they truly designed to cover what Medicare doesn't cover in part or in full. Next is Part A and Part B. So let's dive a little deeper into these two. So Part A covers inpatient care in hospitals, skilled nursing facility, hospice care, home health care. In Part B, your medical insurance helps cover services from doctors and other healthcare professionals, outpatient care, home health, durable medical equipment or DME, many preventive services. And finally, there is a Part D, but we're going to talk about it in a little bit. And I wonder if anyone from the group here can recall how much we pay for Part B. Can anyone put it in the chat? So what's the standard Part B premium amount in 2021? I don't see any answers, and if you don't recall, it's quite all right, because it's frankly deducted out of your Social Security, and it's out of sight, out of mind. The standard Part B premium amount typically gets high, unfortunately, from year to year. So in 2021, it's $148.50. And in 2022, it's most likely to go up. So we don't know that number yet, but it's going to be most likely over $150, and we shall wait and see what it is. Most people pay the standard Part B premium amount monthly. As I mentioned, that is deducted from the Social Security. Now, let me tell you about the Part B penalty. If you don't sign up for Part B when you're first eligible, because maybe you don't feel like you need it, because you don't go see doctors that much, you may have to pay a late enrollment penalty for as long as you have Part B. Your monthly Part B premium may go up 10% for each full 12 months in the period that you could have Part B but didn't enroll. I also hear that some people say, well, you told me it's $148.50, but I didn't enroll late, but yet I'm paying a lot more for my Part B. Why is that? Well, it's because you're working with the government here. It's a government program. And that is, it depends on your yearly income. So I'll give you one example. So if your income is less than $88,000 per single a year, so it's $148.50. But say if your income is above $500,000 as a single, then you'll be paying $504.90, and there's everything in between. So if you are somebody who is above $138,000 per year, up to $165,000, so your Part B would cost you around $386.10. So if you have any questions, I recommend to contact Social Security to find out why your amount seems to be higher than you expected. I also want to mention here that some people decide to, maybe not get Part B because they're thinking of retiring, and they have a choice to select COBRA. And here, some choices to be made. COBRA is not normally considered to be credible coverage for Medicare major medical benefits. So people who are enrolled in COBRA and do not enroll in a Part B within 8 months of turning 65 may face penalties, but it really depends. So if you're considering COBRA and you want to know if that is considered to be credible coverage, please contact your benefit administrator who can answer this question. And another, I guess the thing that people are often consider is like, what if I'm eligible for Medicare? I'm not going to stop working for the next few years, so I don't need COBRA. But here I have to make a decision: do I keep Part B, or because I have this coverage from my group, or do I, sort of refuse it? Well, if you keep your Part B, then you will be paying premium for it, right? The upside to that is that each time when you see a doctor, you'll have this white, red, and blue card, and you have your group insurance card. So what one insurance company doesn't pay, another insurance company will pay for it. So something to consider definitely for people who, have needs, and when they see physicians quite often, and there are some expenses, so maybe paying that $148 a month actually is not such a bad deal, because you have two coverages essentially, and minimum to none out-of-pocket expenses for your medical care. Let's see. And again, if any questions arise there, you can certainly contact Medicare or contact your benefit administrator to learn more. And another point I want to make here, so if you decide to keep your Part B and you continue working, you can actually choose to allow a private insurance company to administer your plan. So you can still enroll in Medicare Advantage plan and keep your group insurance, and eventually make some changes as need be when you stop working. So the key here, if you're thinking about the Medicare Advantage or Plan C, you have to have both Part A and Part B. So what is Part C, or Medicare Advantage plan, that I just spoke about? A Medicare Advantage plan is another way to get your Medicare Part A and Part B coverage. The Medicare Advantage plans, called MAPZ, MA, Part C, and offered by Medicare-approved private companies that must follow rules set by Medicare. Most Medicare Advantage plans may or may not actually include prescription drug coverage, but there are others that do not include prescription drug coverage. So you have some choices there. In most cases, you will need to use healthcare providers who participate in the plan's network. These plans set a limit on what you'll have to pay out of pocket each year for covered services. And remember, you must use the card from your Medicare Advantage plan to get your Medicare covered services. So you see some members, typically have in their wallet, all those important documents. I would say keep your red, white, and blue card at home if you have a Medicare Advantage plan, because this is what you'll be showing the doctor. They'll know to bill a private insurance company. And your red, white, and blue card will get handy if you decide to perhaps return to original Medicare or to join another Medicare Advantage plan, because this number will be needed. And remember that if you let a private insurance company to administer your plan, you still have Medicare. So that doesn't change. Medicare has a contract with private insurance companies, and they do believe that private companies have a way of, adding extra benefits, extra services to keep the members healthy. And there's a star rating that proves or shows how well we do that. Next, let's talk about different types of Medicare Advantage plans of Part C. So there's HMO, Health Maintenance Organizations. There is a PPO, Preferred Private Provider Organization, and there is a PFFS, Private Fee-for-Service plans. Health Maintenance Organization, or HMO, you generally must get your care and services from doctors, other healthcare providers, hospitals, in plans network, except for emergency care or out of area urgent care, or a temporary out of area dialysis. You need to choose a PCP, or your primarily care provider, to let that provider oversee your care. And you would need to get referrals from your PCP to see a specialist. Sure, some may think that it sounds like a lot of work, but know that if you are seeing a certain specialist on a regular basis, your PCP would send that referral and it will be good for a period of time. So it's not like each time you're seeing the same specialist, you have to see a PCP first. No, there is a mechanism that you get a referral and then you will update it at a later time. And generally speaking, if your goal is to obtain most savings and maximum benefits, HMO might be an appropriate choice. Many people shy away from HMO because it's a closed network. So your goal is to decide whether or not the savings and rich benefits worth getting through that step of obtaining a referral from your PCP. If so, do your due diligence and check if your providers are in the network and try it out. Because every year we have this wonderful annual enrollment period that we can change our plan without any health questions asked. But I must tell you that as a market leader for Humana, we do see that HMO plans continue gaining its popularity here in Hawaii. Next on to a PPO plan. PPO plans have network doctors, specialists, hospitals, and other healthcare providers that you can see. You can also use out-of-network providers for covered services, usually for high cost, if the provider agrees to treat you and hasn't opted out of Medicare. You're always covered for emergency and urgent care. PFFS, the private fee-for-service plan, allows you to see any Medicare-approved provider, healthcare provider, hospital that accepts the plan's payment terms, agrees to treat you, and hasn't opted out of Medicare. To my knowledge, we don't have any PFFS plans here available in Hawaii. Now let's talk about a Medicare drug coverage of Part Z that helps you pay for prescription drugs. So even though you don't take prescription drugs right now, please consider getting a plan that includes a prescription drug coverage. Health changes, needs changes, but it's also because there might be a penalty if you don't pick it up when you're first eligible. There are two ways to get a Medicare drug coverage, the Part Z. You can get a standalone Part Z coverage while you keep in your original Medicare, or even if you added a Medigap policy. And, we see that, like I said, this Medigap or Medicare supplemental policies are not as popular. So many choose to select the Medicare Advantage plans that includes a Part Z coverage. And many of those plans are $0. So really, there's nothing to lose. You get your A and B covered, extra benefits because private insurance companies, they compete for your business. So they do add extra benefits. They include the prescription coverage, and you pay $0 or higher. And when we talk about prescription drug coverage, many times this term of donut hole come up. Most Medicare drug plans have a coverage where you may have to pay a higher percentage of the drug cost. And on this screen, you can see that there are some stages here. And let's talk about how it looks like in terms of the coverage gap. So in stage 1, you pay deductible 100%. And I would like to ask you to take a closer look at the plan you are selecting or shopping to see what tiers you would have to pay these deductibles for. Often, private insurance companies or this Medicare Advantage plans let you to buy your prescription, your generic tier 1 and tier 2 prescription without paying the deductibles, and only have you to pay deductibles for brand name medication. So it really varies. Some plans say we only charge you deductibles for tier 4 and 5, while you can get tier 1, 2, 3 without paying deductibles. So if prescription drug coverage is important to you when it comes to selecting a Medicare Advantage plans or standalone prescription drug plan, please take a look at that. So deductibles, how much you'll be paying, and for what tiers you will have to pay, because private insurance companies, everyone has this donut hole embedded because it's a government rule, but deductibles really varies from plan to plan. So in stage 1, if you pay in deductibles, it's 100%. And on stage 2, we call it initial coverage. And it's a shared cost with the insurance company. Both you and the insurance company pay medication cost until the shared total drug cost equals to $4,430. You are generally responsible for co-payments and co-insurance during the stage. In stage 3, and that's the donut hole coverage gap, it begins after you and your plan have spent $4,430 for covered drugs, and ends when your out-of-pocket cost reaches $7,050 for them. In this stage, you pay no more than 25% of the cost for brand name and generic medications. Any medication-related deductibles, discounts you receive on covered brand name drugs, co-insurance, co-payments, and amounts you pay in the coverage gap count towards the $7,050 limit. Finally, stage 4 is the catastrophic coverage that follows the coverage gap. This stage begins when you reach the $7,050 coverage gap limit. In this stage, you pay $9.85 for brand name medication and $3.95 for generic drugs drugs, or 5% of your medication cost, whichever is greater. So now let me mention a late enrollment penalty here. Let's see. And the late enrollment penalty is an amount that is permanently added to your Medicare drug coverage Part D premium. You may owe a late enrollment penalty if at any time after your initial enrollment period is over, there's a period of 63 or more days in a row when you don't have Medicare drug coverage or other credible prescription drug coverage. You will generally have to pay the penalty for as long as you have Medicare drug coverage. The penalty doesn't go away. If you do qualify for extra help, such as low-income subsidy or Medicaid, this penalty will not apply to you. And this question of extra help comes up quite a bit. So there is a full low-income subsidy. It is also partial. You might be wondering, am I qualified? Well, one way to find out is definitely calling Medicare, Social Security. You can also apply online to see if you qualify. And this is just a one-pager that is really easy to submit. To give you a heads up, in 2021, if you file as a single individual and your income is around $1,677 per month, you will definitely need to look into that. Or for married couple, it's around $2,255. You call Social Security, you make an appointment, and they'll help you to take the next steps. If you're about to stop working and consider taking COBRA, please check with your benefit administrator again, just like we talked about Part B, to see if your health plan provides a credible drug coverage. It's important because if it's not a credible drug coverage, then the penalty will apply to you. So you have to do your due diligence and check. So if your COBRA does offer a credible drug coverage, then you'll be able to delay Part D without any penalty. In this case, you'll have 63 days after losing COBRA coverage to enroll in Part D without penalty. In other cases, like I said, it might not be considered. So you really need to look into that. Currently, the late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium, which is $33.06 in 2021, by the number of full uncovered months that you were eligible but didn't enroll in the Medicare drug coverage Part D and went without other credible drug coverage. There's also an online calculator that you may use to figure out the penalty. You can call Medicare and they can help you to estimate that penalty. When it comes to COBRA, speaking from personal experience, at one point of my life, I looked into getting COBRA for myself and my family. It's very, very expensive. At least it was for me. So I would say before, and it's so natural, right? You finish working, you have this group insurance that you trusted, and now they're giving you COBRA. Is that the best choice for me? Well, maybe, but don't jump on this conclusion too quickly, because what I recommend for you to do is get the coverage that you'll receive from COBRA. Look at the co-payments and co-insurance this plan will have you pay, and compare side by side with alternatives such as Medicare Advantage plan. I can tell you from my experience as a Humana employee, I get an insurance, and if I put it side by side with the Humana plan that we offer to seniors in Hawaii, those Medicare Advantage plans are looking very, very nice. In some cases, even less expensive than what I'll have to pay. So again, do your due diligence, check with more than one company, put side by side COBRA benefits, and speak to your benefit administrator, SHAPE or Medicare, about your choices. So let's recap and before I get there, I also want to mention that to avoid paying the penalty, remember to enroll in the prescription drug coverage when you're first eligible. do enroll in the prescription drug coverage when you lose the creditable coverage, whether it's COBRA or your employer coverage. And also keep records showing when you had other creditable drug coverage, because what's going to happen when you join a Medicare Advantage plan, or if you join a prescription drug standalone plan, the insurance company is going to ask you, well, it looks like you have to pay penalty because you are 70 years old and never had Part D coverage before. Well, I did because I worked until I turned 70. And the insurance company will have to see that. So remember that sometimes insurance company asks, sometimes, well, they should ask, right? So remember to keep the records showing when you had other creditable drug coverage, and tell your plan when they ask about it. If you don't tell your Medicare plan about your prescription creditable drug coverage, you may have to pay a penalty for as long as you have Medicare drug coverage. And one example, if you become eligible for Medicare, continue working, turning 65, and at this point, you will get a letter from the employer that you have to submit, and most likely a private insurance company have to fill out, or your agent will help you to fill out that letter. Sounds like a lot, but it's not really. It's quite a few steps just to show what you had before up to this point. So, and penalty comes up quite often. So do I have anyone on the call here who have dealt with that, or knows anyone who is paying Part D and it's expensive? Please put it in the chat. I might have a tip for you. All right. So
Anastasia, there was a question about having a medical plan while she's working. And so she asked, do I need to have Part B as in boy if I have an employer medical plan?
Oh, this is a wonderful question. The answer is it depends, right? So if you continue working and you are satisfied with your health coverage, you may select no to Part B and carry on as you would. So you'll be saving $148.50. But you also have the choice to say, yes, I'm willing to pay for Part B because I'd like to have more coverage, right? And that would make sense if you're someone who has certain underlying health conditions, and maybe you see in doctors quite often, or maybe you just want to have a peace of mind that I have those two coverages. So whatever one doesn't cover, another would. So you have choice of paying for Part B and getting that extra Medicare Advantage coverage to administer your Medicare benefits, or declining Part B. Remember to obtain the document that you had a credible drug coverage and credible health coverage. And so when you decide to enroll, you show those documents and no penalty will be applying to you. And if you have kind of questions are more specific to your particular situation, where maybe we need to look at the plan to see, how well you're covered, because it also depends. Some group coverages are really rich in benefits, and other, they're nice. Please contact SHIP, or if you have any trusted advisor, a Medicare agent, or shop online. And actually, I have something to show you what you can do to on your own to look at your options. So you can do both. I hope I answered your question. So now, one last thing I want to mention about the prescription drug coverage is that in efforts to postpone or avoid getting into that donut hole, a few tips. Please keep in mind that selecting generic medication when it's appropriate, and of course when it's advised by your physician. Use mail order pharmacy if your insurance company offers that. Review your statement, because it will show you how far you're from that, or how close you are to that donut hole. And if you're getting close or already reach a donut hole, ask your doctor for samples, for medication samples. Sometimes doctors do have it. If you have an MDX network, Then they also have an advisor who can help you, or the pharmacist rather, who can help you to look into whether or not samples are available, and maybe make recommendations to call a manufacturer so they can ship you those samples directly to hold you over until we get into the next year and you'll be out of the donut hole. Again, if you are qualified for extra help, so the donut hole will not apply to you. So let's review your options here. So on the screen, you'll see, so when you turn 65, you got your Part A and Part B, and we call it original Medicare. However, to avoid paying penalties for not having prescription drug plan, you have to pick up a prescription drug plan, and that would be standalone plan, and it's right here. If you are concerned about high out-of-pocket expenses, co-insurance, and then many would select to pick up a Medicare supplement insurance on Medigap. However, here in Hawaii, most people select Medicare Advantage plan. It's just one card, one company to work with, and lots of extra benefits, because private insurance companies want to do their absolute best to help you to stay healthy. So there are some incentives there in the plans. So some plans will say, hey, why don't you pay for your acupuncture visits? It's part of the plan. Well, under original Medicare, that might be a lot more costly and a lot more limited. Some plans will pay for your gym membership. Other plans will offer you meals after a hospital stay. Other plans will say, well, if you come with us, we'll give you chiropractic benefit, like more than what original Medicare would. So there's so much to choose from. But what's most definitely we see here in Hawaii, that there are a wide selection of Medicare Advantage plans, and it's very simple to work with one company, essentially one card, and a lot of extra benefits. But again, decision is yours, and now you can see that you have some options here. So next is enrolling into Medicare. So right now, we are during this biggest, what we call annual enrollment period, AEP for short, that started on October 15, and it will end on December 7th. This is the time of the year when you have to shop. And maybe you love your company you're with, but maybe you feel that, gosh, I wish, one or another thing was covered, or I wish this was cheaper, or this was added. Remember that each private company, well, not each, but many of the private companies have more than one plan. So try to see if there's more available within that insurance company that will be more suitable for you. If not, you can also select to look into other plans. You compare the plans side by side, and I'll show you momentarily how to do it. So annual enrollment period is the time when you can do many things. You can drop the prescription drug coverage, you can add it. So, I would say the prime time to shop and make changes if needed. In addition to that, there are other enrollment periods, and we call them special enrollment periods. There's also open enrollment period, which starts on January 1st and ends on March 31st. And there are some limitations there to what you can do, but know that they exist. Every year, CMS sends you Medicare New Book. Not, a certain pager by any means. To some of us, I find it quite boring and dry, but a lot of information could be found there. So finally, what does it take to select the plan that would work best for you? Well, there are a lot of things to consider here, right? So the cost, how much does a Medicare Advantage or supplemental insurance or standalone Part D cost, right? It depends, right? It varies from company to company. You also want to look at the benefits. And this is when it gets hard, right? There's so many benefits to choose from. So how do you do it? Well, ask yourself, so what benefits are important to you? So start where you're at now. And look at your current coverage and see what I really, really need. What is really, really important? Maybe it's hospitalization, where you want to make sure it's affordable for you. For others, it could be very solid prescription drug coverage that offers you most savings. So look at the benefits that are important to you now, how you are receiving them, do they satisfy you? And also ask yourself, if you could change anything, what would it be? Is there anything that is missing from what I'm getting now? And if so, then that's time to start a journey and see if you can do better, really. And the commitment is there that remember that every year you have this annual enrollment period that you can change. So no health questions asked. So it's not going to be a forever plan unless you choose so. And then throughout the year, then and due to your special certain circumstances, you might change the plan sooner. And again, you'll have to speak to Medicare, the agent, to tell you it's available. Convenience. Think of your physicians in the network, and they're looking, somewhere close by. Do you like the customer service that the company offers you? Does it meet the needs? Does the plan, the benefits, all of the above meet the needs, your needs, because they are all unique for each person? And how wide or how accessible the selection of providers. That's why I mentioned earlier that if you're shopping from plan to plan or thinking about it, it's very important to make sure that you check if your provider is in the network. And it's more than just your PCP, your specialists, matters as well, and so is hospitals. So Adrienne mentioned this a little earlier about MDX, for example, that all hospitals of MDX is in the network. So you can also use MDX's website to search more if you're interested to look deeper into the MDX network. But there are others as well, right? So some resources here, the SHIP center, right? There is a Medicare.gov, but I like to show you something in addition to that. And this is where I promised you to have a demo. And I would like to see if everyone can see my screen. Adrienne, could you please give me a thumbs up that you can see my screen? Awesome. All right, so let me change a tab here for just a moment to take us to first Medicare in U-Book. So some of the information I spoke to you about could also be found in Medicare in U-Book. You get it in the mail every year. If you look at the very end of this book, it will give you a snapshots of all of the plans that are available here in Hawaii. I also want you to pay attention to the star ratings. This is very important. It's like shopping on Amazon, right? It shows you how well the plan is doing. Well, in what sense? Well, in all sense, right? How well is our customer services working? How well the providers take care of your health and essentially keeping you healthy? What we do around the preventive screening and how it benefits you. So there's a lot of different criteria, but stars, it's like, if I could compare with shopping on Amazon, I always get something that has the most stars. In fact, I refine my search and start with most stars and work my way down. So use the method that works for you, but it's something definitely to keep in mind. And one tip I want to give you here. So yes, you get this, copy of the book in the mail. It's wonderful. You can also download this book online. And why I like this version better, I'll tell you. So say you have a question. So we talked earlier about, say, COBRA, right? And you wonder, what does it mean to me? And instead of flipping through the pages, when you go to access this Medicare on You online, it's a PDF format, you can do Control F. And Control F opens up this window right here. I hope you can see it, and you can type COBRA or whatever question you have. And then it will show you that right here, there are 5 mentionings of COBRA. So instead of flipping the pages, this will take you exactly to where you need to be. So there's 2 out of 12. So there's COBRA, COBRA, and more COBRA. And you continue on reading that. If you want to read about, part D, then you can see there is, 85 mentions here. So it's one way to kind of help you to get to the right place rather quicker. So that's one way how you can be resourceful and use Medicare and U-Book in this, fancy way. Again, you have to press Control F at the same time, and you'll get this pop-up window and type your word that you're looking for. It doesn't really work with phrases, so you want to keep it to just 1 or 2 words. Now, the next thing here I want to show you is, well, if you really trust yourself more than anyone else, and before you actually get to dive deeper into speaking to somebody, because it could be where you're just not ready to open up and have this full-on conversation, but you do want to know, well, what are the private insurance companies that I could select, and how do they compare? So one is Medicare and U-Book. Your paper version will have those plans available there. I can tell you that we have HMSA, we have Kaiser, we have Ohana, right? We have United Healthcare, we have Humana. So those are some that come to mind, and they'll be mentioning in the book, not the online version. And then you can go to medicare.gov website. This is wonderful, absolutely wonderful research. So let's say, and you can see it in front of me. And by the way, I want to make a note here. There's medicare.com and there's medicare.gov. So you guessed it. The one you want to go to is medicare.gov. If you select a different one, you'll be taken to somebody who will be sending you Medicare plans. And that wouldn't be that neutral party that you want to trust. You might, but I do strongly recommend to go directly to the source. It's medicare.gov. And that's the website that you can see here. So say we want to look into Medicare health plans for 2021. So I'm going to click here, 2021. And then I suppose they're going to ask me some information, create account. I don't feel like doing it. So I'm just going to say continue without logging in. I'm clicking on that. And then it asks me a few quick questions. What type of coverage are you looking for? Well, I really don't know, but I've heard that Medicare Advantage plans are popular. So maybe I'll start here. Okay, so Medicare Advantage plan. And then next thing here is, and that's the last one, is really to put your zip code and press continue. And depending on your internet connection, you'll get it sooner or later. Do you get help with course from one of these programs? Well, let's pretend I just stopped working. I don't really qualify for any of it. So let's do continue. Do you want to see your drug costs when you compare the plans? If you say yes, be prepared to enter all of your prescriptions here. But for this exercise, I'll say I just want to have a scope of a plan. I'm not there yet to look into prescriptions. So I'll just say no and press yes. Next thing happens here is you have all the plans available in this zip code to me. And I would want you to pay attention to the star rating, right? So we have here Humana Gold Plus, HMO, and there's a 4.5 star rating. The most you could get, 5 stars. So this particular plan has 4.5 stars, not bad. Monthly premium, $0. What are the plan benefits? So look at the check marks here, and you scroll down until you kind of get a better gauge of what's there. What I'd like to do here is to say, I'm shopping and I don't want to pay more than $0 here. So maybe I do want to compare the $0 plans available in my area. So I'm going to click right here, add to compare. Okay. And I'm going to continue shopping. Oh, there's HMSACA, my PPO. So let's select this as well. It's $0, meets my criteria. I'm going to choose this. And there's no particular order here. I'm just going down the plan. So there is another one. By the way, how many stars do we have? HMSA is 4.5 stars. The next one is ARP. It has 4 stars. But you know what I want you to pay attention here? You see right here, drugs are not covered. So that's important. So when you compare the plans, pay attention that you compare the plans that includes the prescription drug coverage like we did earlier, right? So HMSA includes the drugs, Humana includes the drugs. Well, if ARP doesn't include the drug, it doesn't mean there is no plan available that does. So this one is another Humana choice plan. We're gonna bypass that. And we have ARP choice plan and drugs are covered. And how much is it? $0 fits my criteria. So let's have this three. I have Humana Gold Plus HMO for 0, HMSA, PPO for 0, and ARP PPO also for 0. And I'm going to click compare. So in this case, it also gives you a button to enroll if you choose to do that. You can go on that website. You can go directly to HMSA ARP or Humana website to enroll, but you can also do it here on Medicare.gov. And this is where you can really compare, you know, apples to apples. So star rating, important. You can see it here. Remember we spoke about deductibles and also important, right? So HMSA has 275 deductibles here. There are prescription deductibles. So there are two deductibles. So there is a health portion, your health coverage deductibles, right? And there's also prescription drug coverage deductibles. And it varies from plan to plan, from insurance to insurance. And you're paying attention to what's important to you. So all plans are 0, right? So the only differentiations, well, not only, but there are many differentials, many difference among the plans. So the star rating, the deductibles, then you have, you know, maximum out-of-pocket benefit, how much you pay for, you know, your co-payments and co-insurance. And here we also see this, you know, this wonderful green and red marks that shows you at one snapshot is what's covered, what not. Naturally, more green you see, richer the plan. But it doesn't mean it's, you know, what may be appropriate for you, right? So pay attention to, so for instance, if you don't need a hearing aid, right? So maybe there's a green check mark here, but it's not really benefit that you care about. So look thoroughly through each of the benefits to see that the ones that are important to you are having that green check mark. Next, specialists, co-payments visits, lab services, and all those extra bells and whistles. Some of the very expensive benefit that often time gets overlooked is outpatient hospital coverage. I had a knee surgery and it's been done outpatiently, which means I stayed in the hospital for less than 24 hours. And if I had an HMSA plan, I would pay 20% of what? 20% co-insurance? I don't know of what, of something probably very high because it was knee surgery. So, and if I had, you know, United Healthcare here, and this particular plan, I would pay from 0 to $425. And with Humana, it would be from $35 to $250. So, and this is just back to my point is, figure out what benefits are important to you. And that's what help you and will guide you to do that comparison. And maybe when I'm done here, I'll say, well, I like this, but maybe I don't mind paying extra. So maybe the next step would be to see what you'll get if you compare, you know, plans within the same company, if you side by side, you know, plans that have the premium. But essentially, I want to empower you and say that it may sound like a lot, but, you know, as long as you know, comfortable using Zoom, and clearly you are, and you know to go to Medicare.gov, not Medicare.com. So go to Medicare.gov, put your zip code in, and compare a few plans. And I know you can do it. So that's all I have for you guys prepared. So thank you so much for your attention, for your time. There's so many things you could have been doing now, but you chose to join us in real time or watch this webinar a little later. So we thank you so much. So if you learned something new today, please share, come back, tell us how we did, share your comments in Generation Magazines, but that's all from me. Back to you, Cynthia and Adrienne.
Anastasia, there's one question. Could you explain the maximum out-of-pocket limit? Because I think when you go through the Medicare Gov, there are different amounts. Could you just go over that, what that means?
Yeah, this
right
is a
there?
very good question. Thank you for asking it. Many people get frightened when they see this high number. I would too. It's actually a very good thing. The smaller the number, the better it is, because it's a ceiling. It's essentially ceiling. So what the company says, if you had a catastrophic year, you're in and out of the hospital or some kind of chronic condition, each time you go to see a doctor, you pay $30, $100, ambulance ride, hospitalization, you keep paying your portion, right? And then the company keeps paying as well. So what they're saying, if in any given year, and let's use HMSA here for an example, they say if you spend 10,000 in and out of network, I'm sorry, 10,000 out of network or 6,700 in network, at this point, the company steps in and says, from this point on, you will be paying your co-payments and co-insurance. So that might be important if you having some illnesses that you're dealing with. So it's essentially a ceiling or a stop loss that once you pay that, say with Humana, $5,850 in co-payments and co-insurance, you're done for the year. That the company will helping you to pay benefits from that point on until the end of the year. And at that time, it starts over, right? And you'll see some changes from year to year within, the same plans, but it's a different conversation. That's why, this time of the year, we always, want to shop and to ensure that we're in good hands. Hope I answered your question.
Any other questions? I don't see any other questions in chat box.
Well, if any questions come up, know that you have, so SHIP, you can call them. You can call directly to a company that you're interested to learning more. Call HMSA, call United Healthcare, call Humana, and talk to somebody who can tell you more about these plans. Due to, recent, events, everyone is trained now to help you to where you need to, in a way that you need to be helped. So if it's telephonic, it's great. If you would like someone to come over and meet with you in person, we can arrange that when it comes to insurance companies. So be resourceful and don't be shy to seek to understand.
Hey, Anastasia, I want to just give you a plug in here. So since you spent an hour explaining and Medicare is complex. So if someone wants to join Humana, because just based on what you just shared on Medicare.gov page, to me, just looking at the three different plans, Humana HMO plan seems to be the least out of pocket cost, because it looks like after I spend $5,850 in a year, I don't have to pay anymore, right? Versus others are almost double, right?
Yeah.
So if I wanted to enroll into your HMO plan, what number is there? Somebody or phone number I could call, or someone you could get me connected?
So I would say if you would like to enroll specifically in the Humana plan, you can certainly look into calling us directly, the 1-800 number. Being that you are a generation subscriber, and I would like to extend my my number as well, so you can call me directly and I'll put you with the right resources. And let me see what my number is. So my contact number is 808-219-9361. Again, it's 219-9361. So I can have somebody here at the local office to help you. I also want to make a disclaimer. At the local office, we don't do any customer service here. So there are usually the agents who help you to enroll. They would be helping you with customer service as well. So for customer service issues, it's always best to call 1-800 number, because they have an access to some of the information that we don't have at the local level. But of course, if serious issues come up, you can call me as well. But call SHIP on Medicare. But we're definitely happy to to get all of you enrolled to Humana, because we believe in our brand, but we understand that there are so many great choices out there to select from. And this is why, we spend time to learning about you. So if you meeting with an agent, it's a conversation. And and this is what I also advise you, if you see that somebody who is speaking to really trying to find out and ask you a question, they're not just being noisy, they're really trying to understand to be able to show you the best choice that would work in your situation, most appropriate choice that would work for you. More you know, better recommendations they can provide.
Okay, well, thank you so much, both of you, for being our speakers today. I know I learned a lot, and hopefully I will be able to retire by 65. But it is good. I do also know a lot of people that are still working past 65, so good to know, what they need to look out for. And I know, you're talking about Ship. So Ship was our speaker last month on the webinar for September 15th, and then MDX did their webinar on August 18th. So we do have a lot of information and past webinars on our generations808.com website. So please, if you have any questions, you can go to the website and watch the past webinars, or you can give us a call. Adrienne is really easy to talk to. So thank you so much for being with us today. I really do appreciate. Just a few things as we finish up. Next month, November 17th, we're going to have Hawaii Meals on Wheels speaking about the tackling food insecurity and isolation during, I guess, this pandemic. But Michelle will be speaking from Hawaii Meals on Wheels November 17th. And the link and all that information is also on our website, generations808.com. Again, don't forget to listen to the radio station from 8 to 9 on Sundays on 101.1 KORL. That we have our podcast and our radio show every Sundays from 8 to 9 a.m. I did want to thank Financial Benefits Insurance, as well as Declutter Hawaii, for sponsoring the webinars for Generation Magazine. I am Cynthia Arnold, and I'm actually from Declutter Hawaii, and Senior Move Manager is hosting the webinars each month. Again, this is being recorded, so please invite your friends and family to listen to our webinars and go to our generations808.com website. Do you guys have any last minute? I think if Adrienne, do you guys have a phone number that we can post on this recording? So if they want to call you, and then I'll have both phone numbers. If you can say that one more time.
Yeah, why didn't you say that first? Because I need to actually look for that phone number. It's going to be, I know I have it. Hold on.
Definitely, it's one thing to remember your own phone number. So my number is
I know, right?
808 219 9361. 219-9361, and that's regarding any enrollment questions to Humana. Feel free to leave me a message. I always return my messages. I know Adrienne also has a local number for you that you can
I
contact.
could just find it. Hold on.
And if all fails, you can always email, and I can get you straight to them. But you have the phone number, Adrienne?
Yes, I do actually. 808-426-7600. Of course, no, I haven't used that phone number because everybody emails me. So I will also share my email address. It's adrienne.yee@mdxhawaii.com. That's ADRIENNE.YI@mdxhawaii.com. So you could actually give me through the email address as well.
Oh, that's a good idea. I think I would like to add my email as well. Mine is shorter. A for Anastasia. Hale is my last name. So it's Hale or Hale. Number 14 at humana.com. So it's Hale 14 at humana.com.
Awesome.
Now
Thank
you
you.
have it.
And they're both very easily able to be reached and both very nice to talk to. So thank you so much for being with us today. I really appreciate it. Again, thank you attendees for coming. If you have any other questions, please feel free to call them directly, or you can always contact me at 808-221-8345. I look forward to seeing everyone next month with Hawaii Meals on Wheels. Take care and aloha.
Aloha.
Hi, mahalo.